Hi, I'm Dr. Mark Olson, and I'm super happy to be here today to show you this model that I've designed on how massage therapy works from a neuroscience perspective. I have a PhD in neuroscience, and I teach classes on the neuroscience of bodywork, pain, and trauma. I also am the director of the Pacific Center for Awareness in Bodywork, which is a trauma-informed neuroscience-based massage therapy program in Kauai. So, with the model that you see in front of you here, what this does is simulate what a massage therapy session does when you modify different variables for the session. And then you get different outcomes depending on how those variables are set. So if you look at the client outcomes on the far right, we've got pain, affect, stress, and spinal reflexes. These are just a few, but they are the main things that get affected with massage therapy. So we can modify this on a scale of 1 to 10. I'll give this person a 6. When they come in on a scale of -10 to 10, I can say, well, they had negative affect of about -5, stress -6, and spinal reflexes at 5. So that's what their starting point is. Over here on the left, in the blue box, this is the therapist input section. So we can modify their relational skill quality, their touch quality, and different aspects about the session. We can turn any of these different inputs on or off however we want, and that's going to change the outcomes. Up in the peach section on the top, we have client psychosocial input. We can modify any of these settings however we want, and that's going to affect implicit safety and client presence, which will ultimately affect some of the activity up here in the cortex. And then we can change the client biological input as well. So I'm going to start with a poor therapist. Hopefully you'll never experience a therapist this poor, but this is where we're gonna start here. We're gonna do average levels of client psychosocials and an average amount for client biological input. So let's just run it and see what happens. So you'll see that the pain here isn't changing. Affect is actually getting worse, as is stress, and that's because the client's relational skills and touch quality are so poor. So you can see that this is not a positive outcome, so let's try something else. We'll try an average therapist. We'll keep all the other variables the same, run it again, and this time, once the touch starts, you'll notice that the pain levels start to drop, and the negative affect and the stress come down to 0. They don't really go into the positive state, but at least you got rid of the negative aspect. So this person would probably say that they don't feel stressed anymore, but they don't really feel relaxed either. So let's try somebody who is a highly skilled therapist in all of these departments. We'll keep all these other variables the same again, run it one more time. And this time, once the touch aspect begins, you'll notice that the pain and all the rest of these variables start changing rapidly, and they go a lot further. So this person ends up becoming highly relaxed and having lots of positive affect. So that's the kind of outcome we want. So again, you'll see here that the outcomes are very similar to what real life is, and this is just happening because of the way the model is set up to actually incorporate everything that we know in terms of what's going on neuroscientifically. Okay, so if you'd like to know more about this, please check out my class on how bodywork works and how pain works from a neuroscience perspective. These are CE classes that are NCB, TMB approved and CE broker approved, and they're offered throughout August, September, October, November, and December. Just go to affinitywellnesseducation.com, and I hope to see you soon. Thank you very much.